Well, if you love someone who has a serious medical condition or is elderly, there is a conversation you should have soon. And it's not an easy one. It's about what kind of medical treatment they would want if they were to get sick with COVID. And perhaps more important, what they don't want. Here's Tom Lydon.
Outside the Hennepin County Medical Examiner's office, a stark reminder of the stakes. 2 refrigerated semis in anticipation of a mounting death toll. The reality is most Americans will recover from COVID, but many will get very sick, very fast.
But it's really the speed with which that's happening that's really taking everybody by surprise.
Dr. Keith Mortman created this 3D image from a CAT scan of the lungs of a 59-year-old man. The area in green and yellow is where COVID has damaged tissue, with fluid and mucus accumulating in the lungs, a condition known as ARDS, acute respiratory distress syndrome. This patient was on a mechanical ventilator to help him breathe. He never made it off.
Unfortunately, right now, there's no treatment. There is no cure, per se, for the COVID infection.
And ventilators simply buy time. The patient is sedated, and a tube is inserted down the windpipe, pushing air into the lungs, filling up tiny sacs that oxygenate the blood. Public health officials fear that when the pandemic peaks, there won't be enough ventilators to go around.
If you need a ventilator and don't get one, there's a very slim chance you're going to survive it. If you do need a ventilator and you get one, your chance of survival increases 10 times.
But it's also true, based on studies in the U.S., China, and Europe, that most COVID patients who go on a ventilator will die.
What are the outcomes that people are looking at once they go onto a ventilator with COVID?
Yeah, the outcomes are sobering, Tom.
Dr. James Pacala is head of family medicine at the University of Minnesota Medical School. He says while only 1% of COVID patients will need a ventilator, they stay on it longer, around 2 weeks, which can permanently damage the lungs, heart, and lead to cognitive impairments. The longer someone's on a ventilator, the less likely they will ever get off. The average age of those who have died from COVID in Minnesota is 87.
Only about a third of the older adults who are on ventilators get off of them.
On the front lines in the nation's hardest hit ICU units, doctors are confronting a grim calculus of who will likely live or die. Dr. Pacala calls it the fair innings rule.
People who are younger, they deserve more of a chance to play out the fair innings of a baseball game. Whereas if you're late in the baseball game, you've gotten to play most of the game. So you have to let somebody else play the rest of the game, so to speak.
Do you believe that people don't understand the ramifications of going on a ventilator?
Oh, I'm sure that they do not.
Law professor Thaddeus Pope says COVID is causing a huge shift in thinking.
The default in everything in American healthcare is we will keep you alive as long as technologically possible.
There are 2 legal documents he says people should consider. An advanced healthcare directive, a listing of your wishes and preferences, along with a designated decision maker. And for those already seriously ill, what's known as a provider order for life-sustaining treatment, or PULST. An order making it explicitly clear what heroic measures you want or don't want taken to save your life.
Don't waste the scarce ventilator on me. Give it to somebody else who has a better prospect of benefit.
And if things get desperate, doctors will likely be making these decisions anyway. Several hospitals on the East Coast have considered blanket do not resuscitate orders for COVID patients. But if there is a conversation to be had in your family about quality of life and the big picture, the experts say the time to talk is right now.
That's really a call to everybody, now to have those discussions with their loved ones and say, hey, if I was placed in this position, what would your wishes be?
And it's important to have those conversations before a loved one's in the hospital when you might not be able to see them and they might not be able to communicate. That said, these conversations are complicated and deeply personal. So we've set up a list of resources over at the Fox 9 app and fox9.com to get the conversation started. I'm Tom Lydon, Fox 9.